Obstructive shock occurs when there's an obstruction causing the heart to not properly fill. One form of obstructive shock is cardiac tamponade. Cardiac tamponade is described as an accumulation of fluid in the pericardial space, and that's the membrane surrounding the heart. And it results in a reduced ventricular filling or a compromising hemodynamic. Some causes are malignant disease, which accounts for 30 to 60%. Uremia is 10 to 15%. Idiopathic pericardiocentesis. Some causes are malignant diseases, which accounts for 30 to 60%. Uremia accounts for 10 to 15%. Idiopathic pericarditis is 5 to 15%, and other infectious diseases are 5 to 10%. Some signs and symptoms to look for is shortness of breath, tachypnea, tachycardia, diminished heart sounds, weak pulses, cold, clammy skin, pericardial friction rub, dizziness, drowsiness, palpitations, and hypotension. Hemodynamic monitoring is done with a Swan-Ganz catheterization to assess the reaccumulation of pericardial fluid. 3 phases of hemodynamic monitoring are phase 1 is when the pericardial fluid causes the ventricles to improperly fill and relax, and that causes an elevated left and right ventricle pressure. Phase 2 is when pericardial pressure is higher than the ventricle pressure and causes a decrease in cardiac output. Phase 3 is a further decrease in cardiac output. Some medications are limited in treating cardiac tamponade, and a pericardial centesis may be needed to remove and drain fluid from the pericardial space to relieve the pressure and the compression of the heart. Positive pressure ventilation should be avoided because it may further decrease venous return and aggravate the signs and symptoms of cardiac tamponade. And here is a drawing of the heart. So this right here, this black line is the visceral pericardium, and then the blue space here is the pericardial space, and this is where the fluid will accumulate and add pressure on the heart and act like it's squeezing the heart and having the heart not able to expand and pump like it normally do. And then this black line here is the parietal pericardium. And then a needle would have to be inserted into the pericardial space to drain the fluid and regain the expansion that the heart needs to pump effectively